At Monash IVF, we take great pride in our IVF pregnancy success rates and the role we play in helping individuals and couples grow their families. However, we know that interpreting IVF success rates can be confusing and overwhelming. Different clinics can present data in different ways, and prescribed treatment types and likelihood of a successful outcome can often vary from person to person. In this video, we will answer some common questions in relation to success rates and point you in the right direction to find out more information. IVF success rates are typically presented as the percentage of embryo transfer cycles that result in a clinical pregnancy or live birth. This means the chance that someone will have a baby after an embryo is transferred into the uterus. To break that down even further, let's look at both metrics. The clinical pregnancy rate is measured by the number of clinical pregnancies divided by the number of embryo transfers. The live birth rate is measured by the number of live births divided by the number of embryo transfers. However, this method, while traditional, can create some confusion when trying to compare two clinics against one another. Clinic results can vary depending on the type of patient they treat, for example, the age of the patient or the cause of their infertility. And different treatment strategies can generate different results. That is why it is so important to look beyond the numbers and consider factors such as age, lifestyle factors such as weight or smoking status, type of treatment, fresh versus frozen embryo transfers, and of course any individual medical factors. It is also important to understand that unfortunately not every patient will have embryos suitable to undergo an embryo transfer, and the chance of this is also dependent on many factors. To get a better understanding of this, it's best you speak to your fertility specialist to assess your personal circumstances and the likelihood of this happening to you. When looking at IVF success rates and medical data, you may come across terms that are unfamiliar or complex. Medical terminology is used to ensure accuracy, but we understand it can sometimes be difficult to interpret. If you ever feel unsure about what a term means or how it applies to your situation, our fertility nurse team is here to help. We encourage you to reach out with any questions. You may have seen messages such as, "We are thrilled to announce our latest success rates," but then when looking at the data realised it was a few years old. Success rates are based on real patient outcomes, which means it takes time to collect, analyse and verify results. Success rates data is often a few years old because pregnancy outcomes are tracked through to birth, requiring a full 9 months. Industry and regulatory bodies ensure accuracy before releasing reports. You can ensure you are looking at the latest data by visiting yourivfsuccess.com.au. The data on Your IVF Success is independently published by the University of New South Wales and shows the success rates of each clinic around Australia compared to the national average. Publication of this data is voluntary. The data on the Your IVF Success website is presented a bit differently to the way clinics may present their success rate data on their own websites. Your IVF Success demonstrates success rates using 5 key measures. Births per complete egg retrieval cycle, including the later transfer of resulting embryos. This measure shows the chance of a live birth from fresh and frozen embryo transfer procedures, resulting from each complete egg retrieval cycle that was performed in 1 year at this clinic. Births per complete egg retrieval cycle, including the later transfer of resulting embryos for females having their first ever egg retrieval. This measure shows the chance of a live birth from fresh and frozen embryo transfer procedures resulting from each complete egg retrieval cycle for women having their first ever egg retrieval in 1 year at this clinic. Births per individual treatment attempt. This measure shows the chance of a live birth from each individual treatment attempt involving an intended embryo transfer that was started in 1 year at this clinic. Births per embryo that is transferred. This measure shows the chance of a live birth from each individual fresh or frozen embryo that was transferred in 1 year at this clinic. Clinical pregnancy per individual treatment attempt. This measure shows the chance of a clinical pregnancy from each individual treatment attempt involving an intended embryo transfer that was started in 1 year at this clinic. At Monash IVF Group, we are proud to publish all the data from all our clinics on this website, as we believe transparency is important so patients can understand the likelihood of a successful outcome. As we mentioned, success rate data can be presented in many ways and it can be very complex. So if you would like more information about the Your IVF success rate data, you can always speak to your fertility specialist or one of our amazing scientists who will be happy to take you through this in more detail. If you are considering IVF treatment, we encourage you to book a complimentary, no-obligation chat with our fertility nurse team to start your journey. Speak with a fertility specialist to understand what success rates mean to you and your circumstances by asking questions about how the data applies to your personal situation. Review success rates data on our site, as well as reviewing independent guidance on interpreting success rates. These resources and links are available on this page. Factor in success rates data when assessing costs for treatment.